Thank you, Mr. Vice President. Excellencies, Fiji welcomes the timely convening of this meeting and the draft political declaration presented before us. We endorse the declaration and commit to achieving the global targets on NCD prevention, mental health promotion, and the pursuit of universal health coverage. We also recognize the central role of the World Health Organization, WHO, in addressing NCDs and mental health globally. Sadly, back home, NCDs and mental health challenges are lived realities of almost every Fijian family. Non-communicable diseases account for over 80% of deaths, hindering Fiji's social development. Mental health issues in Fijian society go unrecognized, leaving adolescents vulnerable to trauma, stress, and substance abuse. These interconnected challenges threaten the well-being and quality of life of Fijians. Your Excellencies, Fiji has legislated health laws restricting the marketing of unhealthy foods, implementing healthy school policies, and developing nutrient profile models. In tackling mental health issues, Fiji is increasing investment in mental health services, decentralizing care, and training health workers to provide psychological first aid. However, stigma, underfunding, data gaps, healthcare capabilities, and rehabilitation remain significant barriers to progress. NCDs and mental health issues are compounded by climate change, food insecurity, and geographic isolation. There is a need for targeted international financing for SIDS to address the rising costs of NCDs and mental health care. In closing, as a small island developing state, we need support to address the phenomenon, and we look forward to collaborate and share best practices with you. Thank you very much.